I'd like to talk a bit about the problems we have as intactivists in talking about circumcision. The largest among them is probably the taboo against even talking about it, which is probably the biggest barrier. Um, People just don't want to talk about it. That's not really what this video is about, though. This is about another problem in talking about circumcision that I would probably call, if I had to give it a name, a cascade of disbelief. Let me just jump into some examples to give you what I'm talking about. I have had conversations with maybe uncircumcised American men, maybe even circumcised American men, and European men. Actually, I recently had a conversation with a European guy, I believe from Bavaria. And these are people that don't know about circumcision or don't really understand it. In the case of the circumcised American, maybe don't even know that they're circumcised. And this problem starts when you try to introduce them to the concept of circumcision. You say, yeah, there's this thing called infant circumcision that's this institutionalized, wide-scale thing where doctors cut off parts of babies' penises within hours or days of being born. In America, anyway. And people literally don't believe you. Literally don't believe you. They can't believe that such a thing is true. This is very early in the Cascade. And, I mean, it is. I mean, it's a fucking shock to learn. This is early in the Cascade, and you can overcome this level of it fairly quickly. I mean, tell them to research American circumcision. You know, yes, this happened to 70% of living American men. The overall prevalence started in the late 1800s as an anti-masturbation campaign among the early medical community. The early medical community embraced it for the physical damage it did to the penis. The claims of medical benefits are this ex post facto garbage that came later. And the rate peaked at 85% around there in the 70s, and we've managed to beat it down to 45%. And you know, you can start to explain these things to them. You can explain the human rights violation. Forced amputation is a human rights violation. Whether it's happening to a girl's genitalia in East Africa or a boy in the maternity ward of an American hospital. Or other mutilations happening to, the foot binding happening to the feet of little Chinese girls 100 or more years ago. You explain these things. Then you get to another level where this is really where the hang-ups start, which is that people can't believe that if the medical field is doing it, that it could be bad. And, I've focused within the context of the medical field, the fact that the medical field itself has been guilty of all kinds of crimes, frontal lobotomy, castration, euthanasia if people deemed defective, electroshock therapy of homosexuals, insulin shock therapy, female circumcision. And people just don't care. And it's so strange. This is where I'm sort of expanding it. We live in a society where the people are skeptical to a point of paranoia about everything else. People on the right are very skeptical of the government. The government, it's a conspiracy. The government's doing this. The people on the political left they don't trust the corporations. The big corporations are doing this, that, and the other. And this gets down to like stupid little things like people getting paranoid about whether Jiffy Lube changes their oil when they go for an oil change, whether you're getting scammed by your auto mechanic. People are conspiratorial about every other issue. They doubt authority. They question authority. And yet when it comes to the medical field, the average person does not question authority, and they take it. They take it on their word. They accept the imprimatur of the medical field. They accept the authority appeal, the rhetorical appeal to authority of the medical field. I don't know how we can overcome this. Maybe you guys can give some input on this. I don't know how to do it short of almost totally delegitimizing the medical community. Amplifying their role in female circumcision. Amplifying the fact that Douglas Dykema, the guy on the 2012 circumcision task force, openly was promoting female circumcision in 2010. Actually, that's a rhetorical point that I have not yet seen brandished during a debate that needs to be used. That the same people at the AAP promoting male circumcision are also promoting female circumcision. You know, these people are not to be trusted. Their authority almost has to be destroyed. You know, which is sad because in many other, you know, respects, they're not that bad, right? The AAP has put out policy statements saying that infants are often subject to horrible, unnecessary pain, and that this needs to be mitigated. Never mind circumcision, but okay, they say that. They say that children down to the age of 7 can partake in most of the elements of informed consent. These are pretty enlightened positions that I quite like. I mean, the medical field is engaged in some other big problems. Intersex normalization surgery, even hypospadias correction surgery. I consider both to be human rights violations of the same type as male circumcision. Unnecessary genital surgery on children needs to be absolutely banned. The standard laid out for female circumcision, medically necessary, needs to be the standard for all children. Male, female, intersex, people with hypospadias. Anyway, I don't know how to overcome this. I'm throwing some stuff out there. Tell me what you think. This is where people stop. We're skeptical of everything else in society, but when it comes to infant circumcision, nobody questions authority. How can we overcome it? Tell me what you think. Talk to you later.